America is in crisis, a national health crisis rarely seen before, the opioid epidemic.
This epidemic cannot be stopped by a border wall or with prison bars. We need leadership.
But we can't simply look to others to lead. We all need to be leaders.
Why? Because we are all mortal, and the opioid epidemic touches each one of us. We have family, friends, or friends of friends who are hurting from opioid abuse.
Oxycodone, heroin, fentanyl. Jobs are lost, relationships destroyed, lives are taken far too soon.
We are mortal, and we need to lead.
President Trump recently declared the opioid crisis a national public health emergency. The president acknowledged the crisis is one of epic proportion, impacting nearly every community across all 50 states. Illegal substance abuse has long been addressed as a criminal justice problem. But our focus needs to change. In the state of Louisiana, heroin possession carries a minimum sentence of 4 years at hard labor and a maximum of 10 years at hard labor with no chance for parole. The penalty for trafficking requires a minimum of 10 years with no possibility of probation. Stricter criminal laws and punishments are not working. The epidemic is growing. We need a national health response. A response where the victims of this powerful addiction are focused on paths of recovery, support, and data-driven resolutions. Opioid addiction is a disease, not a crime.
In developing the MORTL app, we reached out to law enforcement officials to discuss the benefits of technology in the fight against the opioid epidemic.
Yes, I do. I think it's time that we took addiction out of the criminal justice system, stop treating it like a crime, and get people care, and in the long run that would help out both the person and also all the systems involved in government.
I feel like it will be an advantage to police departments across the country if departments were able to receive technology that would allow police officers to spend more time in the field being proactive and making quality arrests and spending more time with the community.
Probably the biggest thing technology would be able to do is more efficiency and allow us to quickly connect systems to people and hopefully get them either help or get them into the system more efficiently.
To battle this disease, the MORTL app provides a path to recovery using pre-arrest diversion and mentoring support. Instead of being arrested, addicts are paired with mentors who lead them through treatment. Police are the gatekeepers to the criminal justice system. By removing the burdens of tedious paperwork, an impediment to police participation in diversion programs, the MORTL app makes it easier to divert addicts into treatment under the guidance of their mentors. Addicts avoid the normal criminal justice system cycle: booking, detention, prosecution, conviction, and incarceration. Police hold any criminal charges in abeyance to encourage addicts to seek treatment. Meanwhile, mentors lead their mentees on the pathway to recovery. The MORTL app is intended to be companion technology to the Seattle Police Department's LEAD program, which stands for Law Enforcement Assisted Diversion. LEAD has gained widespread acceptance in the law enforcement community, but LEAD could benefit from technology designed to more easily track and monitor the recovery of addicts. The app has 3 primary components: a tracking system for those going through diversion, a matching algorithm to pair them with mentors, and a monitoring process to assure police that diversion is successful. If it isn't, police will file the pending charges and let the criminal justice system take over.
When the number of opioid addicts increased in America, so did health costs, incarceration, patients in treatment centers, mental health counselors with appointments, and funerals. Opioid addiction is a disease. Mentors are a deterrent. The National Drug Court Institute implemented mentorship to combat drug addiction, and mentorship is winning. Since 1989, the Institute confirmed that mentored drug treatment significantly reduces addiction more successfully and less costly than any other justice strategy. With the national increase of opioid addiction, facilities offering peer mentorship recovery programs are exhausted with wait lists, and police are extending Narcan between completing incident reports. This portal is a profitable alternative to exhaustive wait lists and extensive paperwork. The portal will assist in assigning a mentor to help opioid addicts become healthy humans again. The mentors will give guidance through the sobriety stages, recognizing risk factors, forming communication skills, and learning coping mechanisms. Now is the time to supply the demand for the mentorship treatment to counter the opioid crisis, and using this application is how. The MORTL portal will help locate, facilitate, and integrate mentorship as an alternative that can save states money, time, and lives.
In fact, 175 lives are lost every day to opioid overdose. Consequently, federal, state, and local governments are budgeting billions of dollars to combat this epidemic. For example, the failed Senate health care bill to repeal and replace Obamacare included $45 billion for state spending on opioid addiction treatment. Louisiana received a federal grant of $1.2 million to participate in a pilot treatment program and $8.1 million to enhance its existing statewide prevention, treatment, and recovery services. The MORTL Portal app fulfills an unmet need to encourage the diversion of opioid addicts into treatment instead of jail. We are unaware of any existing technology like ours. As state and federal funding to address the opioid crisis expands, we will actively pursue those dollars directly on our own and indirectly through partnerships with other technology vendors. The opioid crisis is a crisis for all communities, and all communities need leaders. Leaders that the MORTL Portal app will provide to addicts, managing opioid recovery through leadership.